I wanted to touch a third rail in all of these discussions, and that's tiers. Effectively now we have two tiers, one tier for countries in the lowest levels and another tier for the largest, and then companies and countries in between have not so pleasant conversations about how to get something in between. In order to get to sustainable financing that allows for resources for R&D and continue to push for new opportunities in vaccines and also provide access in countries, are we getting to the point where we absolutely have to take on the politically difficult conversations and just start pushing for multiple tiers, however we design them, so that we have a system that allows companies to do R&D, to understand what their market's going to be and have some stability around that, but also allows countries to know where their purchasing costs are going to be for vaccines at their various stages.
As to tier pricing, I mean, clearly it has to happen. It should be linked to income levels. Obviously also, though, pricing, is dependent very much on uncertainties, isn't it? I mean, I remember I heard in the dinner on the first day that very powerful comment about, we don't want Gavi money, we want Gavi prices. Well, that's all very well, but it comes back, one, to the point about, what's your own economic capacity? Is it justice about whether it's right to effectively being subsidized by richer countries for, taking advantage of that? But it's also, it raises questions again about going beyond national level and looking at things like pooled procurement. Why couldn't we have more middle-income countries together collectively negotiating with some of the vaccine companies? The quid pro quo is obviously there is a larger pool, a greater degree of certainty. My gut instinct is the Western companies could go further if there was greater guaranteed purchase, underwriting, and so on of those things. But, and it's been great to see at this forum, even compared to 3 years ago, more and more of the big pharma companies getting back involved in vaccines. But I do hear also the tensions and the pressures, and that tail price is not going to be a driver of business decisions, and particularly when you see the last 2 or 3 years how pharma companies have ended up cutting their R&D overall because their investors just aren't willing to truck what's frankly a huge roulette wheel going largely wrong in R&D, not delivering results. They certainly aren't going to tolerate large amounts of management time, let alone money, going into very incremental vaccines at the bottom end of their profit portfolio. So I think it's a delicate balance that we have to achieve.
It's not only about raising international resources. It's also about the debate that we also have had here about vaccine pricing. That's a separate issue. And of course, the whole embedding of vaccines in health systems, the delivery systems, etc. But overall, we are astonished. If you think about that, it's widely understood that vaccines are one of the most cost-effective interventions in healthcare. And it's astonishing that actually countries, despite co-financing policies, despite policy dialogue, despite the economics behind that, are not giving it the type of commitment that actually one would perhaps expect. For the London replenishment meeting, we did some little back-of-the-envelope calculations. And it's actually, that even astonished me more. If you think about, we just looked at the proportion of Gavi financing as a proportion of total health expenditures, even in poor countries. Now, very astonishing. For countries like even Malawi, it's less than 2.5% of total health expenditures. In countries in Rwanda, it's less than 1%. And in Nicaragua, it's 0.3%. Now, you could argue such, as a proportion, small amounts actually could be raised nationally. Gavi and the international financing should be used to introduce new vaccines, to have this catalytic role, to take the risk, to provide the training, the capacity building, and of course the initial investment. But as we mainstream this, I think there is an increasing role that countries need to assume.
As far as co-financing is concerned, I think the underdeveloped and the developing countries and the lower and the middle income countries should be sensitized, and they should be sensitized about how the vaccines get manufactured, that what is the process, and they should be sensitized that they won't be kept on donations, won't be kept on this donation or the contribution from the industrialized world, but they should stand at their own. they should welcome and they should facilitate the public-private partnership. They should, in Pakistan, pharmaceutical manufacturing company, that sector is very strong. And if the government can facilitate that private sector, I think they can manufacture the vaccine. So this is important. And once the high-ups, the president and the prime minister is going to be sensitized that how and what is the need for addressing immunization and vaccination, I think that can work.
But I think we all need to keep our eye on that sustainability. As you've said, Minister, that's what countries all want. That's what everybody wants countries to be sustainable. So we have with the very lowest tier, everybody has to co-finance. For every new vaccine, you have to co-finance. So that's something they take into account. And it's 20 cents for the lowest. Then for the middle group, it's 20 cents additional then with an inflation factor built in, so it's growing. But for the top group that are going to be graduating, we actually have them on a co-financing trajectory. That means by 2016, and there's 16 countries that will graduate in 2016, they should have on their books sufficient funding to cover those vaccines. So I think it's incredibly important. And one of the really exciting things that came out of the big industry package that was announced in the lead up to the pledging was that quite a number of the companies have now agreed that for those graduating countries, they can continue to be funded under Gavi prices. And that's really important. It's important, I think, for countries, and the Minister, you might want to comment, countries making a decision in the first place to take on those vaccines, that they're not going to hit a cliff and then suddenly have to do full pricing.